Welcome to Public Forum, a community outreach program produced at North Idaho College on the shores of Lake Coeur d'Alene. Featuring guests from around the globe addressing a wide variety of subjects, Public Forum serves to educate and enlighten. Please join host and moderator, political scientist Tony Stewart, in welcoming today's guest.
A series, we like doing that. Sometimes it's even 3 or 4 weeks on a subject, and for this week and next week, our topic is the use of massage procedures and the whole process of massages to promote good health. We live in a society where stress and tension is extremely high, and this particular process is very helpful to good health. And we're very, very pleased to have as our guest a friend we've had for a long time, and she has a school that is certified in the state of Washington, and she has a school here in Kootenai County, and also one that's planned very soon in Boise, Idaho. Welcome to the program, Jeannie Plastino-Wood. Jeannie, I've known you for a long time, and you are now the Director of Education for the American Institute of Clinical Massage, and I congratulate you, and we're going to talk a lot about this procedure and all the things that happen in your school. And in the program, we'll also talk about you're the only school in the West that has certain status, and so again, thank you for coming and being with us both today and next week.
Thank you very much, Tony.
And as always, I'm pleased to have our regular panelist, who is, we usually have two, but today Erna Reinhardt is here as our one panelist, and she is the Director of Public Relations at North Idaho College, and she will start today's questioning.
Hi, Jeannie. Welcome to the show. It's great to have you here. Let's start out, first of all, by sharing with the viewers how it is that you got into massage.
Well, it's not a very glamorous story. I was in a position in my life where I had 2 daughters, a single parent, needed to find a way to support all 3 of us. And I have an aunt who's a physician, and she encouraged me to go into massage therapy. She said it would be the fastest growing field in healthcare, alternative style. I had never had a massage, never heard of massage, nor did I want to get a massage, but I did want to support us. So she's always given good advice in the past, and so I went to massage school and fell in love with the industry.
And so then did you work for several years as a therapist yourself?
After I finished school, got out on my own, there was so much I didn't know. And so I went back to school to study the body, European style, their philosophy and their techniques for working with injury. And then I went to work for a physician here in the area in recovery. Anything that was in litigation, car accidents, abuse patients, we worked on all of those.
Great.
So.
Thanks.
Jeannie, I just want to delve right into the heart of this process, this alternative medicine. Actually, maybe there's even a better term, because physicians have their role and responsibility. They have surgery, they have medication, they have lots of things they do, but I look at your work as a lot of preventive medicine, in the sense that if you're in good health and you eliminate a lot of tension, you may prevent high blood pressure or strokes or something, or at least lessen that opportunity. So let's talk about the mechanism itself, and your school has a lot of students. I believe you have about 65 students right now.
That's correct.
And so just kind of take us through, like you would an incoming student. What do you say to them about why their profession will be so important, and what they need to know about the body and how they use these procedures?
The way that we're made doesn't support the lifestyles that we've created. So massage therapy is not something that's going to go out of fashion. In fact, it is appearing to be the healthcare of the future. Not massage by itself, but combined with other treatments. We devalue relaxation, but yet when we look at our lifestyle, we wake up to the sound of an alarm clock, startled. We go through our day with, it's so busy, everything that we have to get accomplished is going through our mind over and over. Then we drop into bed at night, setting the alarm clock, thinking of what we have to accomplish the next day. We don't have time to rest. And there are several things that have been proven about massage therapy. For example, when you're getting a massage, there's a point where you feel like you're asleep, but you know you're not. It's during that stage of a massage that tissues actually repair, as if you were getting a good night's sleep. So some of these stress-related disorders that are out there now are benefited by massage for that rest factor, for being able to just rest.
I've heard from others too, experts, that if sometimes some people have very poor sleep habits, or it's restless sleep. But so you're saying that if you can, through this massage that's taking place, if you can really relax, it's similar to when you would be having a very good night's restful sleep. Is that correct?
That's correct.
Then in relation to that, let's talk about tension and its direction of the body. I've heard medical doctors say this too, that as we increase our stress, it attacks different portions of the body. Some of your students or your graduates they come to North Idaho College sometimes during midterm and finals, which is really a stressful time, and they've been very nice and the student union to do massages. And I've heard them talk about, as they find what I call tense spots or sore spots, they'll say, oh, the tension has gone there. So give us some indication about points within the body where tension is directed and how the massage can attack those tense places.
In general, the mechanics of massage on tissues goes a little bit like this. When you tense up, whether it be emotionally or you do a repetitive tight movement, a muscle will spasm. When the muscle spasms or contracts, the blood flow is compromised.
In that particular location.
In that particular location. So the blood carries the oxygen, also carries away the waste. So that tissue becomes hypoxic with lack of oxygen in there, but it also becomes toxic with the byproducts that can't be removed from the area. So it burns or it aches or it just knots up and stays there. Massage manually goes in and moves that fluid, moves the fluid through the tissue so that the circulation is restored. You see people walking around grabbing their neck, giving themselves massage and putting pressure on there and doing the same thing that we're doing. It's a natural movement to make on the body.
I've done some shows with physical therapists, and in fact myself, I had a fall and accident once, and I was having really problems with the shoulder, and I took too much time waiting to deal with it. But this physical therapist who was trained in Europe, he was quite amazing. He said that from the injury you get scar tissue, and sometimes it's surgery, but he was able to take very strong hands and 3 times a week break that loose and even cause it, I guess, to bleed, and then to ice it and exercise. So is that kind of the same principle where he was getting blood flow going again and trying to heal a section that had problems? There's a similarity here?
There's a similarity. Good for you being able to withhold that. That's pretty painful work. They call that a cross-fiber friction work that they use in Europe. And what happens is when scar forms, it forms, you can picture it like cottage cheese. It clumps together.
Right.
When you go in manually, they go in to break it up again and create, they damage that surface, that scar tissue, re-injure the area. Then with their movements, they get the scar fibers to lay flat. So it restores a certain amount of movement without pain.
And blood flowing better. No?
And the blood flowing better.
Well, it's not like a massage. It's not pleasant, but
that's not a pleasant thing.
the end result is good.
Yeah.
Erna Reinhardt.
Jeannie, let's talk for a little bit about the different types of massage, because I know that there's different styles, and I can just think of a few: Swedish massage, and now there's the hot stone massage and a deep tissue massage. Tell us a little bit about each of those, and then if there are some additional different types of massage, maybe you could explain those to our viewers. So let's start with a Swedish massage and what that entails.
Swedish massage is a combination of 5 different strokes that have French names, but the French don't know why. So we have Swedish strokes with French names, and each one of these strokes is done a different way but has a different effect on the tissues. And they can be light or deep. A Swedish massage is light or deep. That's what you'll find in most massage treatments, most spas, is a Swedish type stroke. Deep tissue is just that. Sometimes you want to get down deeper to break up scar. It's not as painful as what you've been through, Tony, but it is still a deeper tissue that goes down and gets blood flow moving close to the bone. Let's see. Hot stone massage or Luss stone massage is probably the most amazing treatment that's out there right now. A true Luss stone massage is done with hot basalt stones and cold marble or jade. And what they do is they do a regular massage, but they do it with hot rocks in your hands. They line out your spine. You're laying on hot rocks. They put hot rocks on your chest, hot rocks under your hands, hot rocks between your toes, hot rocks under your neck, and one on your head. The heat comes from both sides of your body, warms the blood in the aorta, gets some of the nerves to relax, and just knocks you out. You get stoned the right way. And then they follow the massage with cold marble and jade, and the cold constricts the blood vessels, whereas the heat dilates the blood vessels. And so you get a pumping motion in the blood vessels, hot and cold, constriction and dilation, which pumps the lymphatic fluid through. It's a powerful lymphatic massage, very detoxifying.
Excellent.
Stays with you.
Are there other kinds of massage that I didn't mention?
There's so many.
Yeah.
There are so many techniques out there. We have continuing ed workshops at the school where we look for different types of massages. We have a couple in Mayan massage coming up from Aztec persuasion, which I don't know anything about, but I'm excited to learn. Lomi Lomi, which is a Hawaiian type massage that moves the body with the rhythm of the seas. Many. There's so many.
And then would you suggest that the different types of massage are used in different applications for different kinds of tension or different kinds of problems in that person's body, or is it just a preference, or both?
It's both. You'll notice that if a person is nervous, they rock. Mothers are rocking their babies. Even if their babies aren't in their arms, you'll see them in the grocery store standing and rocking. There's a whole technique called Traeger that rocks the body. So sometimes when people are so tense and they just cannot relax, they'll start moving the body by rocking it, and the nervous system will automatically give it up. It won't resist it anymore. So it feels good, very relaxing, and helps to relieve some of the stress that people might be feeling. So it is a preference, and it does all have a certain aspect in recovery or healing.
And then I wanted to ask you a couple questions about your students. Your students must learn about all of the systems in the body. They must learn about the skeletal system, the nervous system, the circulatory system, muscle tissues. Can you explain to us about the curriculum and how long it would take to go through the program before you became a licensed massage person?
We have a unique program to the area. We start everybody with an introductory program. It is part of our 900-hour program, but the first 150 hours is for those who think they would like massage, but they're not sure. Massage is something you have to love. If you don't love it, you won't be any good at it, and that's the bottom line. So they come in and they experience just learning how to give a good massage and see if their body mechanics are going to hold up to that kind of work. Also, they do 50 hours on complete strangers in our public clinic. At that point, they can say, I love this, I want this as a career, or, I didn't mind touching family and friends, but strangers, I really don't want to do that. And they can stop there. If they decide that they want to be a clinical massage therapist, they go on to an additional 750 hours. In that program, the students learn anatomy, physiology, college level. They learn all the systems of the body. They're going to be health care practitioners, so they need to know the bodies at the same level that the nursing students know it at. We don't just teach anatomy for massage therapy only. We teach them anatomy, college level. Pathology, kinesiology, or the muscle movement, all the muscles of the body, not just the major muscles. They learn where the muscles originate, where they insert, what their actions are, where the synergistic muscles and the antagonistic muscles are, and what nerve fires these muscles. A lot of work for them. It's their sciences. The whole program takes about 15 months. And then when they complete that portion, they can go on to a medical massage certificate, of which our school is the only medical massage school here in the West. And they learn a specific technique for injury at that point.
Excellent.
So.
Another issue that I think will be helpful to our viewers, because our purpose on this program is to inform our viewers on some subjects they may not be very familiar with, and they also have interest. A person comes to you, and we're going to talk either today or next week about children too, because that's something that's really important to you and of interest. But an adult comes to you that's very busy and very stressed, and she or he have incredible responsibilities, and they want to learn to relax, and they've chosen this path. Do you take them through some kind of analysis? Because Erna's talked about the different types of techniques, and it's kind of like with the medical doctor. Is there some diagnosis that's helpful to find out which kind of massage would be the best for them?
We do a screening with every client that comes in, make sure that they've seen their primary care provider, that they don't have some other issues going on, that massage does a lot of things, and there's some things it just doesn't belong into. It's for other professionals. So we do a screening and find out if massage would benefit them. We don't believe massage is for everybody in every situation. When it's determined that massage will help them, then we start determining where and why the muscles are tense that are. If they are on a phone all day and they have their head cocked, that's going to happen. We've also noticed that people who are listening to lectures, answering phone calls, listening to a lot of people maybe angry with them, telling them off, their shoulders will start to rise, and it's almost as if they want to put them in their ears to block out the noise. So we end up just going through a whole screening process with them, and then determining what type of massage we'll do on these individuals.
And I visited to look over your facilities before this program, and I noticed from your conversation with some people there that also there's certain kinds of injuries that are accidents and they've been with their medical doctor, maybe they even had physical therapy. So they're real strong candidates for massage also, aren't they?
Ordinarily, insurance is a big part of our health care, and they will delegate so many treatments to alternative care or to physical therapy for each patient. When those are used up and the patient is still in pain, that's where the student clinic and the therapist really come in handy and shine. The cost is very affordable. They can continue their care, and here are some alternative ways that have been used to maybe help.
Someone comes to you and they don't have any kind of injuries and they don't have a whole lot of stress in their life. Those people do exist.
They do?
Yeah. Not many, but I'm sure. And they just want to, maybe I'm using the wrong term, and they just have a right to enjoy themselves, and they want to maybe be pampered a little bit. That is, the massage just feels great. Are they also candidates for coming to your facility?
Yes, it's as I said earlier, we underestimate the impact of just relaxing. If they got up in the morning and they had a list of things to do, they will benefit just relaxing. We used to take naps when we were children.
Yes.
We used to be made, and now as an adult, you would just love to take a nap in the middle of the day, and it's the same principle.
Yes, but oftentimes you don't get that chance, do you?
Well, we feel so guilty. I hear that a lot in there's no reason, I don't have anything wrong, and so I really shouldn't just relax.
I shouldn't be good to myself.
That's right, yeah.
Erna Reinhardt.
I'm curious, Jeannie, about the physiological benefits, because you explained that very well, what happens to the muscle tissue and the circulatory system as that massage is is being delivered, how long do those benefits last? Because I know when I've had a massage, you feel pretty good for a while, but as a massage therapist, what do they tell you? Do the benefits last hours, days, or even a week?
That's kind of a tough one. I know with lymphatic massage, 14 hours after the body is still almost siphoning the excess fluid out of the tissues. Massage, general Swedish massage, I'd say 2 to 3 days. You would benefit from your first massage. Other than that, it's hard to tell what goes on physiologically. I know that people sleep better. We know these things as a fact. They've been proven. When you get a massage, your blood pressure lowers. For how long? Probably until you leave the room a little while later and maybe hit that stress factor again. We get a lot of patients for lowering blood pressure. We know that it releases endorphins. We know that it lowers cortisol, which is the biggie right now. Cortisol is a stress hormone. They know that massage lowers that stress hormone in the blood. They know it breaks up scar tissue. They know it gives you a feeling of well-being. We hope that it would last. I know that when you get an hour-long massage, the comment we hear regularly is, "Can I have another hour?"
Work can wait.
Exactly. Oh,
Yeah.
exactly.
So,
Great. What would you say? I think a lot of people have that. A lot of people are nervous about going in for a massage because they feel like their bodies aren't perfect or whatever. But what would you say to someone who may be out there viewing this show that would love to come take a massage but may be nervous about that? What would you tell them?
they're the majority. and this is why. You see all these pictures and posters of day spas that have these people laying pretty much nude on a table with a little washcloth covering them up. That's not the way a daycare operates, and most certainly a Washington State program. We're in the healthcare profession, so when you come in, you're always draped under a sheet and a blanket. If we're working on your arm's exposed. If you're working on a leg is exposed. But nothing other than that is what's showing. Don't not come and receive the benefits of a massage because of that. You're welcome to come in swimming suits. You're welcome to come in jogging shorts. Whatever it takes, you do not have to be nude to get a massage. That's an interesting question because we did a survey to find out why people weren't coming in, and this was 9 years ago when we first started the school. And it was set for senior citizens primarily, and the first reason was they thought they had to be nude. The second reason was they thought that they were going to be injured and hurt because you see James Bond and Hilga and these very strong people that do that deep tissue massage, no pain, no gain type attitude. The third reason was cost. They were on limited incomes, and so they worried about the cost because it's out there as a luxury, not as a maintenance thing, just a luxury. And then the last reason was the one that changed our whole way of operating in the school, and that was many of them were widows and widowers. It had been so long since they had any type of friendly, nurturing touch that they just as soon not be reminded what it was like. And so from that point on, we changed the way we operate.
That is just really interesting, and that's so intelligent to do surveys so you know how to serve the public. We're going to have you back next week. We got a little time left, but for our viewers who might want to contact your school or they have needs that we've been talking about today, I believe we have a website and we have a phone number for sure. And would you share that with the viewers too?
Yes, if you'd like to call up to the spa, it is 208-773-0773. And our website has a lot of information both about the program and about the student clinic and also about the effects of treatments on there. And that is info@AICMtouch.com.
And we did put that up on the screen, so it's up there now for people to look at. For those who are rushing for a pencil, I will give the number again, 208-773-0773. And I also should add that your school and your massage clinic and all is located in Post Falls, Idaho, and it's up on a hill overlooking the valley, which is so beautiful, and it is the Highland Golf Course area. It used to be your building used to be a restaurant, and it's you've redesigned it, and it's beautiful. And next week on the program, we will be showing a lot of your facilities and how you do that. In the short time that we have left, my other question would be to you. I have a friend who her husband bought her a year's certificate for massage. She had a lot of headaches and all, and she's a great writer, but they went away when she started doing this. With your, I guess I would call them clients, is maybe an appropriate word, what's the normal amount of time that someone like her comes to your, is it every week, or how? What kind is their schedule?
A lot determines on the cost.
Sure.
Our cost for a 50-minute massage, just a little less than an hour, is $25. And if you can do that once a week, you'll see the benefits of that. If you can do it once a month, still. So the people that come, some of them come every week, some come once a month, some come, there's a different pattern for all of them. That's right. If you have something chronic that's bothering you, like the headaches and things like that, every other day for like the first week, that's where we work on it to restore that circulation and to get that muscle to let go.
And so just once a week or once a month and all wouldn't, if it has that kind of condition, it would not be very wise just to do it rarely, because you need that attention almost immediately.
If massage is indicated, you're going to know that right after you get your first massage.
Okay. Yeah. That's a very good note on which to end today's program. Jeannie, thank you so much for being here, ladies and gentlemen. We've so enjoyed bringing this program dealing with the use of massage procedures to promote good health and to reduce tension, and that is certainly what this program is all about, to give you assistance on information. And we've been receiving some comments from our viewers recently. We appreciate that very, very much, and you can do that by contacting us at North Idaho College, 1000 West Garden Avenue, Corleen, Idaho, 83814. We're always glad to hear from you. We love your suggestions. We will be back with you next week on this same issue, dealing with the use of massage. Until then, we wish all of you a very good week, and please join us again next week. I am Tony Stewart.
Recorded on the campus of North Idaho College, Public Forum is the longest-running in-house college production on PBS. Each episode is pre-recorded live and is an educational outreach from North Idaho College. Please join us at this same time next week for another edition of Public Forum on this public television station.